Hey brain, is saturated fat good for us? Depends for what purpose. For our liver? Well, then let's look at a study where they overfed three groups of people 1000 calories a day. 1000 calories a day extra? Yes, the first group got all their extra calories from saturated fats, the second one from carbs, and the third one from unsaturated fats. What did they eat? Well, the saturated fat group got all their fat from butter, blue cheese, and coconut oil. The unsaturated fat group got it from pesto, olive oil, and nuts. And the carbohydrate group got all their extra carbs from orange juice, some sugary beverage, and 200 grams of candy. 200 grams of candy? It was for research purposes. Anyway, after 3 weeks of overfeeding, they checked how much fat deposit was on their liver. Guess who had the highest fat? The carbohydrate group. Nope, it was the saturated fat group. They had a 55% increase in fat on the liver. Carbohydrate was at 33% and unsaturated fats at 15%. So saturated fat is the problem. No, silly. The extra 1000 calories a day is the problem. Remember, the entire group was overfed, and that is why our primary challenge is overconsumption. Only after that can we come to point number 2, which is which macronutrient is better? Is it carbs or fats? And as far as dietary guidelines are concerned, saturated fats are not encouraged. But that is a Pandora's box I will open on another day. Today is just to highlight that overconsumption is our main challenge. And the best way to address it is through exercise and stress management, because they do help us match our appetite to our needs. And secondly, balanced meals, which means enough fiber, protein, healthy fats, and reducing carbs to maybe 40-50% of our total calories. And of course, it is important to personalize, so feel free to tweak around and figure out what works for you. Give it a try.